que já podemos então empezar.
Okay, I think we can
Uma vez
start.
mais, bem-vindos ao nosso
Welcome once
webinar
again
de
to our new webinar
RedETSA. Legamos
of
a edição
RedETSA.
número 48.
This is number
Em
48.
pouco tempo já estaremos celebrando os 50
We will be
webinários
holding our
de
50th
nossa rede.
webinar shortly from
Hoje
our
vamos
network. And
tema
today
Tomando decisões em saúde por
we're talking about
leituras
driving
sanitárias,
health decisions from
ferramentas para
the
o
health technology
diagnóstico
assessment tools
e
for
avaliação
adaptation of
dos
reports
lugares hospitalares.
and the assessment of health technologies in hospitals.
Desejar agradecer
We
a
wanted
nossos
to thank
ponentes que em momento
our
necessário
speakers that
compartilham
are
dessas
going to be
experiências de
sharing
desenvolver
experiences
esses
of
documentos,
developing
essas
these documents,
publicações de RedETSA
these
que vocês
publications,
já conhecem,
um,
já hemos
and which you all
disseminado
know.
essas
And we had
publicações
already
com
disseminated these
os
publications
membros lá
with
da nossa comunidade, da
from
nossa
the
rede,
members of the network. They're public.
né?
They're
Publicações
not just for
disponíveis em
the
nossa página,
members.
vocês
These
podem
publications are available
nesta
in
aqui,
our webpage,
aqui no
and our
chat,
team
os
will
enlaces
put the links
desses
here on the
documentos.
chat in a bit.
E hoje vamos atender uma
And today we are
oportunidade
going to
mais
have an
de
opportunity, one more
disseminar
opportunity to
essas,
disseminate
importantes publicações para a nossa rede, para a
such
região como um
important
todo.
publications for the
Hoje
region
temos
in general.
conosco
Today we
queridos
have here with
amigos e
us
amigas
dear friends
de nuestra red
from our
para hablar
network
de la herramienta de
to talk
publicación de
about
informes
the
de reportes
tool
activos
for report
temporais
adaptation. We have
de nuestro
Christian
centro
Dorati
colaborador de la
from our collaborating
RedETSA
center of
em uso
WHO
racional
in
de
Pajo
medicamentos,
on the
esta
use
La
of
Plata,
medications.
segundo essa La
Um,
Plata, e também na Alicia Alemã,
and we also have Alicia Leman
Universidade de la República
from the
Uruguay. Los
University
dos
of the Republic
são
of
membros do
Uruguay.
grupo de trabalho
Both
sobre
are members
adaptação
of
de
the
informes
working
de
group
regulação
on
operacional
adaptation of
RedETSA
reports
e han
on
liderado
health
esse
technology
processo de
assessments of
construção
RedETSA,
deste documento, como estamos
and they have led the
disponível
construction process of this document that is now
depois
available on our webpage.
para
And
hablar
then
de la publicación
to
sobre
talk
evaluación
about
de
the
tecnologías
publication
sanitárias
on
en
the health
hospitales.
technology assessment
Vamos a tener con
in
nosotros Marisa
hospitals, we are
Santos,
going to have
del Instituto
Marisa
Nacional de
Santos with us
Cardiologia
from
do
the
Brasil,
National
que ha
Institute of Cardiology of
liderado
Brazil, who has led
elaborado todo o
and
documento
drafted the entire
revisado
document,
por outras pessoas, pero que
and
foi
that has been revised by other people
desenvolvido
also,
por Marisa
but it
e
was developed by
com toda a sua
Marisa.
experiência neste
And with
tema,
all her
reconhecida a
experience,
nível não somente da região, para nível internacional.
she's very well
Gostaria
recognized not only in the
já
region but
novamente
also
agradecer
internationally. So I not only want to
elas
thank them
por la
all
participação na elaboração do documento,
for their participation in drafting of the
sino
documents,
obviamente
but
todo o grupo de
also
trabalho, as
the
atividades de nossa
entire
rede,
working group on
sempre
the
muito
network's
ativos,
activities. Everybody's been
panelistas
very
contribuindo
active, and
neste webinar.
also we
Eu não
have
vou
the
falar muito
panelists and the
sobre os
speakers of this webinar. I'm
documentos,
not going to talk so
porque
much about the documents
essa é a
because
ideia
they
que
are going to be
todos
talking about
expertos
this.
vão falar.
They are the
Antes de me
experts, so they are going to be talking.
agradecer
But I would also
sinceramente
like
a
to
equipe
thank
aqui de
also
avaliação de
our
tecnologia
entire
sanitária
team
da
for
RedETSA,
health technology
o
assessment
secretariado
at
de
PAHO,
RedETSA, agradecer a Malena
the
Forte
Secretary of
Queiroz,
RedETSA,
pelo liderazgo aqui em nosso secretariado de la rede,
and for their leadership at the Secretariat of the
muito
Network,
ativa e vocês conhecem bem,
always
sempre dando
very
seguimento a
active,
todos os temas.
and
Também
you
a
to
Vânia
follow up on
Canurto
this
e
constantly. Also, Vane
supervisores,
Canurto,
Caroline
who's also with
Regma,
us,
a Flávia
Caroline
Salomão,
Regma,
de nosso
Flavia
time de
Salomon,
avaliação de tecnologias, e a Lisete
from our
Nunes,
team of
nossa
technology assessment, and
assistente,
Lisette,
que
our
sem ela
assistant.
não íamos
Without
realizar
her,
esses
we
webinários,
would
porque
not have been
tem
able
todo o
to organize
processo
these
mais
webinars because she takes
para
care of the entire
facilitar,
process.
agradecer aos nossos intérpretes
We also want to thank our
e assim
interpreters and
esta
also
equipe que logra poner sempre
this entire team
de pé
who is
esses webinários
always
e
ready to
realmente
organize these
meu trabalho
webinars.
é
And,
muito sencillo,
and,
é
and my task is
simplesmente
very
conversar
easy.
com vocês e ter
It's just
algumas
to come
palavras de
here and
abertura
talk
que
to you
também
and give some
me
opening
ajuda aqui
remarks.
para
And
recordar e
that also helped me
sempre os talking points que me ajudam tanto.
with the talking points that helped me
Obviamente
so
não vou
much.
falar muito, pero queria
I'm not going to
somente
talk
registrar
too much, but
isso
I
é
wanted to
resultado de
record
muito trabalho. Eu he
that this
acompanhado
is the result of a
os
lot of
webinários
work.
anteriores de la
We
rede,
have discussed
em
this in the
sessões
previous
virtuais,
network
presenciais,
meetings,
etc.
in
E
online and
quando
in
examinamos
person
algum
sessions.
documento, enfim,
And many times when we look at a
depois que
document,
compaginamos todo o trabalho aqui a parte de
um,
trás, todas as discussões e tentativas
we can't really think about how many things are behind this, the consensus and everything. And these are people
muchas vezes trabajando
who many times
de
are
forma
working
precária, ¿no?
as
Y tratando de
volunteers.
encontrar tiempo entre todas las cosas
They
que
have to
hacen,
find the
¿no?
time between all the
Entonces,
things that they're already
es súper
doing, and we are
como
so thankful for
esta
this.
herramienta de
And
adaptação de informes,
when we talk about the reports
a ideia aqui
adaptation
é buscar
tool, the
eficiência
idea here is to look
nos
for
sistemas. Nós
efficiency
sabemos
in the
que há
assessment processes,
uma
and we know
quantidade
that there
de
are
agências, de instituições de avaliação de
so
tecnologias, etc.,
many institutions for technology assessment that are doing these reports, and many times
querem ter alguma
they
guia,
want to
alguma
have
orientação de
some
como
sort of
fazer para isso.
guidance
Então, há
of how they can.
experiências, houve uma experiência
So there's
em 2010,
experiences in
aí
2010
na rede europeia, que já não existe mais, a
in a
RedETSA,
European Union that doesn't exist anymore,
é
UNETA.
outro sistema,
Um,
que empezou aí essa discussão
but
na rede
that
de
started with this
saneamento,
discussion. It was a network that
primeiro
existed for a
junto
long
com a
time,
RedETSA e outras redes, e essa
created way
discussão já
before
vinha
RedETSA,
de adaptação de informes
and
e
Data
coisas
had
assim.
already talked
Este grupo,
about
isso
adaptation of reports.
né?
So
Isso
this
realmente
group
visou
did
muitas experiências também da área de
this
espanhola,
great work.
então
This
eles
they have a lot of
construíram
experience.
uma ferramenta bastante
So they've built
prática
a tool that
que
is
pode
very
ser
practical
utilizada
that
para
can be
essa
used
adaptação,
for
evitando
this
duplicação de
adaptation,
esforços, aproveitando a
avoiding
experiência do
duplicating efforts and
conhecimento
taking advantage
acumulado
of the
por outras
experience and
entidades, por
accumulated
outras
knowledge
entidades,
by other
facilitando
bodies
muito
and
mais
other
rapidez nesse
assessment entities,
processo de
allowing greater speed
conhecimento,
in the processes,
reduzindo
more efficiency in the
decisões em
processes,
matéria de
speeding up decision
incorporação
making
dessas
in
tecnologias
the
nos
incorporation of these
sistemas de saúde. Então,
technologies
essa
and the
vai
health
ser a
systems. So
apresentação
this will be the
do
presentation that will be
escritor
shared
Fabrício Alemã
from
sobre
Christian
essa
Dorati
ferramenta de adaptação de
on
informes.
the reports
Depois,
adaptation
vamos a
tool.
ter a
Then
apresentação de
we are
Marisa
going to
Santos
have
sobre
the presentation by Marisa
documentos
Santos
sobre a publicação
on
sobre avaliação de técnicas
documents
sanitárias
on
nos
the
Caribares,
publication
não, na
on
América
the
Latina e
assessment
Caribe,
of health
passos
technologies for
bastante
hospitals for
simples
Latin
como
America
fazer
and the
avaliação de
Caribbean,
controle sanitário nos
practical
Caribares.
steps
Também
for
documento
health technology assessment
muito
units.
concreto.
This is a very practical and
Diferente, sabe,
concrete
de uma ideia mais
document. The
teórica, uma
idea
ideia mais
came from a more theoretical
aplicada
practice, but it's a more
de
applied
como
idea on
os
how
hospitais podem aplicar
hospitals can
técnicas de
apply
avaliação de tecnologias sanitárias para apoiar suas
the
decisões.
health
Então,
technology
percebemos que
assessment
não há
to be
uma
able to support their
contradição,
decisions as well.
não
We
há
knew that there wasn't a
uma
contradiction
contradição entre sistema centralizado,
between a
coordenado,
centralized and
nacional de
coordinated
incorporação
national
de tecnologias
system
sanitárias
for incorporation of health
unidades regulares.
technologies
Esses
and
são
hospital
processos
units. These are
complementares,
processes that are
processos complementares que
complementary,
seguramente Marisa vai
and
abordar
surely
essa
Marissa will
complementariedade
address this
em
complementarity
sua apresentação.
in her
Ah,
presentation.
Dizer que creio que
I want to
estamos vamos
say that
abordar, não, que
I think that Marisa will also
essa
be
história
addressing
por
this,
detrás, como isso foi
um,
crescendo,
how this
cada vez
started to
fortalecendo
grow
mais esse sistema
and strengthening the
de avaliações
system
locais em
for local
hospitais,
assessment,
proporcionando esse responsáveis de
and
decisões
providing
hospitalares uma
this responsible
experiência
decision making
mais fiável para a adoção de novas
that
tecnologias
is more reliable for the
e
adoption of new
seguramente vai
technologies.
mostrar
And
também
this will
o
surely
movimento
show
internacional
also
nesse projeto,
international
não? Que
movement
Marisa participado de
uh,
vários projetos
that
também
Marissa has participated also from several
internacionais,
projects,
também
international
a União
projects,
Europeia
and
apoiado
also the
essas
European Union has
iniciativas de
supported different
fortalecimento de avaliação de
initiatives for
tecnologias sanitárias
strengthening
hospitalares.
of
Então, isso vem
health
variamente
technology
estabelecendo
assessment in hospitals.
força
So this is growing, this is
creio que já
gaining
é um ótimo
strength,
momento
and
para que
I
nossa
think
rede
it's a
possa
perfect moment
dedicar
for our
realmente
network to be able to
tempo
dedicate once
específico
again
a este
specific
tema.
document to
Nós
this.
estamos muito contentes, nós
So we are so happy.
lançamos já há um
We already
tempo, agora
launched a while
já
back
estamos no
this
processo
document,
de
and
tradução em
right now we're in the
espanhol
process
do
of
documento de
translation
avaliação
into
de condições
Spanish of
ocupais.
the
Então,
hospital technology assessment
estamos muito
document.
contentes com esse logro de nossa
So
rede. Este
we're so
logro não é
happy
só
with this
deles, não?
achievement. It's not ours, it's
O
yours.
secretariado ha apoiado, obviamente,
That the Secretariat has
porque
supported,
se não for
of
o
course, our
trabalho
role.
dos
But if it
membros
weren't by
que han
the
dedicado
work
tempo
of
a
the
este,
members who have
aqui
taken
estão
time to
representados,
work on this and they're represented here
Cristian, Alicia e Marisa,
by
então
Christian and
essa
Lisette and
integração dos membros
because if it weren't for the members that are involved, this would not have been possible.
Eu havia me olvidado de mencionar os
Um,
aspectos aí
I want to mention
operacionais,
the
você
operational
mencionou como a
aspects
gravação
here,
vai
but
estar disponível depois.
I know that the recording is going to be available later, as always.
Os três
We
canais
have
mesmo, inglês,
interpretation
espanhol e
in the three
português.
channels, English,
Entendo que a Marisa
Spanish,
mencionou
and
já que os
Portuguese. I understand that
portugueses
Marissa will be presenting in
os colegas
Portuguese.
hispanohablantes
So the
também utilizavam
Spanish-speaking
o português, assim
colleagues
que eu
uh,
sugeriria
can listen to the interpretation.
a
Marissa speaks
gravação.
very fast, so I
E
suggest you
Marisa, por
listen to the
gentileza,
interpretation.
piedade de
And
nos
Marissa, please have mercy
já
on our
mais
interpreters.
despacio.
Try to
E
speak a little bit more
obviamente
slowly.
Christian e Alicia vão nascer a
And of
apresentação em
course,
espanhol.
Christian and Alyssa
Não
are
sei se
going to do the
temos nesse
presentation
momento
in
os nossos
Spanish.
colegas
I
da
don't know if
RedETSA
right now we
também em
have our
inglês.
colleagues from
Se não
RedETSA
temos,
from the
acredito
Caribbean
que
in
no
English,
caso
but
do
if we
nosso
do,
canal de
they are
transmissão
surely
em
connected
português.
in our English channel.
Esses vão estar disponíveis, obviamente, na página de
This is
RedETSA,
going
no
to
canal
be
de
available,
YouTube,
of course, at the
Parro
RedETSA page
Parro
and the
TV.
YouTube channel of Paho
Realmente creio
TV.
que
And
podemos
with
encerrar
this,
a
I
nossa
think that
segunda
we can
abertura e
close this
passar
opening
diretamente.
session
Entendo que nós
and go
teremos a
directly. I
coordenação, a
understand that
moderação
today
de
we are going to
Marilene.
have moderation by
Temos mais de
Maria.
150
We
participantes
have over
conectados. Muitíssimas graças
150
por o interesse
participants
nessa
connected. Thank you
sessão
so much
e
for your interest in this
vamos
session.
então dar início aqui às
And we are going
apresentações.
to
Vou
be
submeter
starting
aqui a
with the
Marlene para a moderação.
presentations.
Muitas graças, Marlene.
I will hand
Por
this
favor.
over to Malin. Thank you so much, and the floor is yours. Thank you so much, Alessandre. Welcome, everyone. Alessandre, thank you so much for your words of recognition. And I know we all work with a lot of dedication and pride for this purpose that we have for public health in our region, and especially for our dear and recognized RedETSA. It's a pleasure to moderate this webinar, which shows the latest publications that we had from RedETSA in Pajo to support from the health technology assessment with decision-making in health based on evidence. First of all, we are going to present the tool for adaptation of assessment reports for health technologies. And as Alexander was saying, today we have two members of the working group by RedETSA on the adaptation of reports on the assessment of health technology, Alicia Aleman and Christian Dorati. Alicia is an OBGYN and epidemiologist with a diploma course on public health from the University of the Republic of Uruguay, and she has a master's degree and a PhD in research and biomedicine by the Autonomous University of Barcelona. She's director of the academic unit of preventative and social medicine of the University of the Republic, and she also coordinates the health technology assessment unit there. Christian is a physician. He is a researcher in the Center of Medical Science of Universidad de La Plata in Argentina, also collaborating center of Pajo and WHO. He's a member of the Service of Teaching and Research of two hospitals, San Roque and High Complexity Hospital. He's also the coordinator of the research room of San Roque Hospital. Please, Alicia, you may start with your presentation.
Hola, buenas tardes. No sé si me.
Okay, good afternoon, but good morning. Sorry. I don't know if you can all hear me.
¿Se escucha?
Can you hear me? Yes, we can hear you perfectly. First of all, thank you so much. It's a pleasure to be here. And I hope that this presentation will be of use to you and to encourage you to start using it. And at the end of the presentation, we're going to leave our emails, Christians and myself, and we would love for you to give us feedback as a product of the use of the tool in establishing the adaptation of reports to the local reality. So first of all, let's start. Next slide, please. First of all, I want to say that the tool is called adaptation tool. It could also be called adaptability tool for the assessment report on health technologies. And now we will see why I was explaining this. The teams that we use for the entire process of the development of this tool are expressed here and are fundamentally from the FUFAR Center and the Health Technology Assessment Unit of the Academic Unit of the School of Medicine of Universidad de la República. However, it should be mentioned that there were many other groups that participated in the entire process, maybe in smaller times, but many of the groups that are today a part of RedETSA. Next, please. So what is our roadmap? First, we are going to mention some definitions. I'm sure you all know about them, but it's good to be on the same page, talking about adaptive technology assessment and the tool, how it was generated and how it evolved. And then we will be presenting the tool and we will be making some comments and final reflections. Next, please. So, starting from something that maybe is a concept that we all know about, but it would be good to mention again. What is understood by health technology assessment? It's a multidisciplinary process that uses explicit methods to determine the value of a health technology in different stages of its life cycle, understanding health technologies from their broadest concept, from medicines, devices, procedures, etc. And what is the fundamental objective of doing a health technology assessment? It's to contribute efficient and high-quality health systems. This is a final objective of doing the health technology assessment. Next, please. So, what does a health technology assessment include? Well, these steps, which are the basic steps, which is formulating the right question. What is it exactly that we want to assess? What is the scope? Identify the evidence or the lack thereof on the benefits and risks and costs of this intervention, synthesizing the findings obtained after finding the evidence in terms of efficacy and effectiveness and safety and health interventions, assessing the economic significance and the different types of economic analysis, and also assessing the importance it has from the social and ethical standpoint. Also, what is related to the organizational aspects. And lately, for several years, including the concept of equity and environmental impact. So this entire process that seems very simple when we look at it, in reality is long and it takes time. And what we intend is to identify the best practices to improve health. The final element is to be efficient in improving the health of the population. Next, please. So, what is the current situation? You know that in recent years, the appearance of health technologies has been amazing, new ones. Nowadays, there's thousands of health technologies, and there's so many that are emerging. And out of all of these, just a fraction will be able to be studied through a full assessment of technology, and this requires an intensive assessment process also for review and analysis, as we have mentioned, following the processes. And this process takes time and takes resources and fundamentally human resources, and generates a gap between the production of the report and the need to make a decision. And surely you all have faced this gap for somebody to ask for some information and that you're drafting the report and you still don't have it ready. And this takes time. But we have to make decisions also in time and form. Next, please. So, in the world currently, as I mentioned, based on the WHO in 2022, there were 88 agencies for technology assessments, agencies or groups. Nowadays, there's surely more than 100. There's 5 networks at least of agencies or groups that generate health technologies. And here we have some of them. Each one or most have repositories of health technology assessment reports. You can look at RedETSA at the bottom. It's a print screen. It's a bit old because I tell you that if we go into the Brisa webpage today, there's 4,418 reports in the repository. And if you go to the one for INATA, the network of public agencies, it has over 24,000 reports. Of course, they started their repository many more years before RedETSA. But what I want to say with this is that there are so many technology assessment reports, and that maybe many of them, it's not even necessary to do them again. Maybe we need to think about some ways for adaptation, and this is what this webinar is about. Next, please. So, what is this adaptive health technologies or health technology assessment? There isn't a unanimous definition that is well established. There can be certain heterogeneity with the concept. However, all of them involve this concept of doing adaptive assessments, focus on a structure to select and carry out the optimum analysis of health assessments that already exist. So it's about using documents and processes that already exist. And the objective is to be more efficient in trying to adapt the time of analysis, the data sources, the information leveraging, and using it to make decisions in other environments that weren't the ones where the assessment was produced. And this process, however, though we're going to see that the classification varies, while there are still differences, it's important for this to follow the key principles for technology assessment. The adaptation or adaptability still needs to maintain transparency, independency, and stakeholder consultation. In general, we use these adaptive technologies assessment when it's difficult to complete a report or we need to make a decision with a limited time. However, this is a decision of the groups. Each group will be able to decide if in the conditions where they could carry out an assessment again, if they decide to adapt a pre-existing one. Next, please. So, there is a scope review, an exploratory review carried out by Nemtsov et al. And it's a scoping review. You have the quote where the authors studied. The objective was to determine and doing a mapping if there are methodologies to adapt these types of reports. And also not just that, but how much is the concept of adaptation used and what methods are used. So in reality, they identified they did a search in the bibliography with very well defined inclusion criteria on what kind of documents they were looking for. They're fundamentally methodological, but in some cases also they were adapted technologies assessment. So based on the methodology, the search, they map in the world and how many places is the strategy used. And additionally, what they do is to classify what it's like they're doing a typology of what is considered or what groups of adapted technology assessments exist. So you see here, this was published in 2023. This was done basically in 21 and 22. And here we have the distribution of countries in the world. The green ones are the ones that systematically use, because this is called adaptive HTA. And the ones in yellow are the ones that mention them. So that this means that occasionally they might use them. So you see their region is basically yellow. Next.
Entonces, esta es la clasificación. ¿Cómo
So this is the classification. Have you classified these documents of adaptive technology assessment? So they're classified by a first group, which is fast reviews and synthesis of the results of the technology assessments of other countries. They assessment, they review them, they synthesize them. But they don't clarify, they don't establish if they do an assessment of the quality of these reports. Second, the second group are that it's requested by the technology manufacturers to do the entire process of technology assessment, and in the groups, they assess this process critically. And this is the way that they adapt the reports. The third group is the one for transfers. What they use is a process that is well structured and regulated with a checklist to determine and guide the transfer of evidence and consider the aspects of quality of the report with a fundamental element. The fourth group is the analysis of cost and effectiveness. It's more focused on costs, and what is done is fast analysis based on the construction of economic models using maybe local values, but obtaining the models in other environments. And then finally, the one that's called de facto, which is a very heterogeneous group that includes the review of regulatory documents that are used as a basis to decide whether to use a technology or not. Also, the indications that are registered, prices of medications, clinical effectiveness based on different types of records or studies, and cost effectiveness. Next, please. So, our tool is actually focused on the classification of the third classification group. So what we're looking for is a tool that will allow to know if a technology is transferable to my environment using a structured process and a well-established list of what aspects we must assess. Next, please. So this is the tool. And what was the history? We started to study this aspect. This was in 2018, and we saw that there was a consultation for the agencies members of NADA. And what we saw there was that from the institutions that replied, just 10 to 20% of the reports that were produced were an adaptation of others. This, we did it in RedETSA during the 10th meeting in Buenos Aires, and from what we consulted in this instance, we saw that 36% were doing some sort of adaptation of reports with methods and tools developed locally but not standardized. So we discussed in that meeting and then internally in the group what's justified to do this tool, because there's a growing interest in developing technology assessments.
And it is very institutionalized. Every time more institutions that are linked to the government are using this type of technologies of evaluation, and so they need this input. There are certainly restrictions and limitations in our region, sometimes with very few technical resources, and the need then is to develop a new ETS, a scarcity of finished resources, reliable information, way too long evaluation times, and then the need to simplify processes and optimize resources and a good and a suitable tool for the region. And maybe in summary, as we say to our students when we are teaching them, the decision is something that needs to be made still. So we have to make that decision timely. We have to find a way to optimize time with high quality, knowing that we are going to adapt something that is high quality and that is something that we can fit into our settings. Okay, so then why do we need to reuse this? And this helps into this understanding because it is to use the developments that are in other places to the most, and on the other hand, is to not uh, redo. In the past, we used to do an important application of technology in reports. And when you consider that, and particularly in efficacy and security and safety was very similar because, well, studies are something that we always see. So I understand there's a difference when you think about economic analysis and stuff like that, but in efficacy and safety at least. So what is it that can be used? Okay, so we could use the summary of an ETS, particularly when you're really in a rush. The ministry called and said, I have a press conference in 5 minutes. At that point, you would use a summary. But what's ideal in there, it's the actual update of reports that already exist, the adapting of these adaptations. So in order to use the update, which is to actually have a report that may be a bit old and to update it. So if it's outdated, we need to complement the search and upon that base to be able to identify scientific evidence that is more local or recent. Then we have the so-called adoption, which is the use of a report, an HTA report. And if I find one that responds to my question of interest that was done in a country that has features very similar to mine, particularly in terms of healthcare system and that it has high quality, okay, I wouldn't say that it's updated, but maybe it's useful enough for us to adapt it to our reality. And it is quite difficult to find a report with such characteristics. But then what could be doable is the adaptation, being able to extract information that can be used for a report and that can be partial or that could also incorporate some other aspects that are local. So what was the history of this process? Like I said, we started in 2018 and then we put the adaptation team together. And so it was like a first phase where we were looking for the pre-existing tools. We identified the dimensions being used for inquiring into the groups to be able to identify, because one of the elements of the adaptation is that the process may be so thorough that sometimes you could even question yourself, okay, to obtain this information, in the end, I'm spending so much time that I could do it all over again. It's not so much, but I'm giving you an extreme perspective. So if we look into all the dimensions that we're using in other tools, that's what we did, and we bring it up to consideration of teams. And in a way, we created like a priority list. Then we have the pandemic. In 2021, we withhold activities, and in 2022, we revisited the development of this guide. And in 2023, when it was almost ready, we submitted to an external review by the Technology Evaluations Network. So this is the tool for the adaptation of technology report evaluations. This is the site where it was published back in 2024. So what was the objective? To be able to generate a technology evaluation tool that allows me, with the report that I have, a revision of an HTA that I get, or if I have several, was done with high quality and it is adaptable to my own setting. So in the methodology, basically we say we're able to conduct the search, we check the papers that we had to be able to identify similar tools that already exist. We identify the dimensions we felt that could be adapted according to an internal inquiry. All the members of the team for this first version tested it. We took one technology evaluation, one report, everybody approved, and then we conducted some modifications afterwards. And then when we obtained the tool, we sent it to a group of experts and made the final modification. And last year we approved it during a workshop. We had done it internally, but we did it this year during a RedETSA workshop. So these are some of the tools that already exist that we found. And then this is like the process that you would start considering the adaptation. And that's when you have and identify a problem, a need within our healthcare system and the incorporation of some technologies and I plan and the whole idea of the report with my team. And then I'm able to identify if there is any report. There may be more than one. And so I decide if I am able to adapt one of them or tailor it to my reality. And there may be the possibility that there are none. That is a possibility. New technologies don't have reports. Sometimes there are no reports at all, or they don't have reports that can be adapted. So I have to create a whole new one. Now Christian will address you about the tool itself. Go ahead, Christian. Okay, thank you, Alicia. I expect you can hear me well. First of all, thank you for the invitation, Alexandria, Melanie, the whole group in RedETSA for the invitation. And as Alicia had said it, to us it's very important to be able to share this tool with all of you and so that you can get to know it. It is published in RedETSA's website. As Alicia also mentioned, it is very important that we keep in mind that we are sharing this as two teams that have been working throughout the whole process. But there are many other authors that worked with the tool and that you will find in the published document, of course. And so I'm going to try and introduce it to you the fastest possible so that you know about it. And if there are any questions, we can look into them during our Q&A session. But our big message is that you're able to get to know it, use it, and to have a feedback with you so that we can improve this first version of the tool that was published. If we had to define this tool, the tool has 3 modules. Those modules include altogether 22 questions, and amongst them there are 5 questions that have to do with screening or fast screening. As you see on the screen, there's a module 1, which is the quick testing, the quick screening. And we're going to look at it and then we'll evaluate whether these questions are answered negatively. Then the suggestion will be not to take that report that is being analyzed to tailor it. So the suggestion is either bring another report or check it from the beginning. In module 2, we'll checking the quality of the HTA report with 2 domains, the use of technology, and the other one with efficacy, effectiveness, and the safety that is being assessed in that report. And then module 3 on the feasibility to be tailored into the local context. Something to mention in terms of the structure of our tool is that this is a qualitative tool. And so we're going to see that it has some questions that have dichotomic. So they're either yes or no, or if the question can be partly responded. So then there's a space for the given observations. And the tool altogether comprises this part, which will be a little bit like a checklist, like Alicia mentioned. And then we have a glossary where we have the clarification of some terms that are being used throughout the tool. And then there's another part, which is like a guide, where each question that we are asking in our checklist is further explained, so we can all speak in the same language about what is it that we are after to be answered by that question. So that's what actually comprises the tool and its total. So if we're to talk about the checklist, in the tool, on screen, you're able to see the first module, which I said has to do with the quick screening with the 5 questions. And as you can see, it is a checklist that is more qualitative, like dichotomically establish whether that question is present or not, and if it doesn't apply. And if it's partial, then there's another column that you don't see on screen that has to do with remarks that is considered in the tool. So in these questions, we find that we're trying to globally evaluate the quality of that report. Initially, to not invest time if these questions are not answered as a yes. So first of all, we're trying to evaluate if the healthcare issue is being evaluated correctly for what we're trying to tailor the guides, or if we are trying to use one of those parts to be adapted. Is that health technology is clearly established, and the date of the report, the authors of the report, if the conflicts of interest have been clarified about the authors of the document, and if the evaluation report's methodology has been properly described. So once again, if these questions don't have a yes, then we do not continue with the other modules. Then the second module has to do with the HTA's report quality with its 2 domains. In the domain of use of technology, we have some questions, as you see on the screen, that have to do with whether the population, the intended population has been clearly defined, the comparison elements, the interventions, and the clinically relevant results. Then the information provided in that HTA, whether if it has been thorough, if it's complete, then if the sources of information are clearly documented, described, and have a clear affiliation as well. And then the option that sometimes could be useful, because sometimes a part of the question that is being established may apply and some others not. So we could adapt the partially and as answer, and then in the observations or remarks column, we can clarify. And also, if we have information about the regulatory condition of that HTA. Then we have the domain of efficacy, effectiveness, and security. And so in this case, due to time, we can only show you some of the questions that have to do with these domains. Some others that are very, very important, but in this domain, we are starting with something very essential.
Si esa búsqueda es pertinente según la pregunta pico que tenga formulada el informe, si se incluyen los criterios de inclusión y de exclusión de los estudios que se están utilizando en el informe, entre otras preguntas, si se evaluó la validez y el riesgo de sesgo de esos estudios, si la variable que se está analizando como variable primaria era o no relevante. Eso se pregunta tanto para el dominio de eficacia y de efectividad como para el dominio de seguridad. Y también hay otras preguntas muy importantes en estos dominios que tienen que ver con de qué manera se nos está brindando la información respecto de los resultados de la eficacia y de la seguridad. Si esa información se brinda en términos, digamos, en medidas de asociación de términos relativos, o si también se incluye en, digamos, términos absolutos, si hay una evaluación de la certeza de la evidencia, utilizando metodología GRADE u otra metodología en todo ese informe. Es decir, hay otras preguntas que complementan este dominio de eficacia, efectividad y de seguridad. Y por último, el módulo 3, que es el módulo de factibilidad de adaptación al contexto local, ¿sí? Este módulo para nosotros también es muy importante porque, como todas y todos saben, muchas veces quizás el informe puede ser correcto, pero bueno, lo que no existe es una factibilidad de poder aplicar ese mismo informe al contexto local que se pretende. Entonces ahí hay 3 preguntas en ese módulo que las ven en este momento en pantalla. En primer lugar, pensando si el riesgo basal que se espera en el entorno es el mismo o no de los pacientes que se están considerando en ese
patients that are
informe de
being
evaluación
considered in that
tecnológica
report
presente en la
of technology
data.
assessment.
Si el entorno donde se va a implementar
So if the
la
setting where
tecnología
that
dispone
technology is
de los
being
requisitos
implemented
necesarios
has
para
all
el
the needed
uso,
requirements
si
for
hay
the
alguna
use,
medida
if
especial,
there is
algún
a
recurso,
special
mantenimiento
measurement,
u
a
otras
resource, maintenance,
necesidades,
or other
y en
needs.
última instancia, si hay
And lastly,
probabilidades
if
de
there
que la
is a
relevancia del informe
possibility
haya
for
variado,
the
sobre
report
todo
to
debido a
have
nueva
varied,
investigación que se haya
particularly
iniciado
to
o
a new
completado o
research that
publicado
has
después de la
started,
fecha de
published, or being
realización del
published
informe. Esta
after
pregunta
the
también es
date when the
obviamente
report
sumamente
was issued.
importante
This question is
para
also
considerar si
very
la
important
evidencia sigue
to consider
siendo
whether
vigente o no a
this
la fecha
evidence
en
is
la que se
still
pretende
standing
adaptar el
as
informe
of the
actualmente.
date when the assessed report
Entonces,
is
como
to be
conclusiones,
adapted.
la
So,
herramienta
as
es útil para el
conclusion,
propósito de
the
simplificar
tool
procesos y
is very
optimizar recursos,
useful
por
for
lo
the
menos
purpose of
de esa
simplifying
manera
processes and
lo hemos
optimizing
evaluado
resources.
y lo han
At
evaluado
least that's how
ciertos
we've
miembros del
evaluated,
equipo que hemos
or
trabajado.
several members of
Consideramos
the
que podría
teams
asistir a
have
la
helped
toma de
us with.
decisiones más
And we consider
oportunamente.
that it could
Como
help
les mencionaba, y
into
algo
a
importante,
more
no es
timely
un
decision
score, es
making.
decir, no hay
And as we've
un
said,
punto
this
de
isn't a
corte a partir
score.
del
So
cual
it's
uno
not a
pudiera decir
point
el
of
informe es
where we
o
could say
no
this is
posible
a
de
report
adaptar,
that
porque
is
es una
possible
herramienta
to adapt or
cualitativa.
not.
Y
This
por
is
otro
a
lado,
qualitative
también por
tool.
eso, como
And on the
mencionaba
other
Alicia,
hand,
y
as
el
Alicia
grupo,
had said it,
pensamos que es una herramienta que lo que
and
evalúa
the
es eso, no es
team, we
evaluar la
feel that
la
the purpose of
adaptabilidad.
this tool
Es
is to
una herramienta
assess
que lo que evalúa de cada
adaptability.
informe
It's a
es
tool that
si es
is
o
looking into
debería o
every
no
report
en
if it
su
is or
conjunto ser
if altogether
posible de
should or could
adaptar,
be
ser tomado ese
possible
informe para
to
adaptarlo al
take
contexto
this
local.
report and tailor
No
it
nos
into the local
menciona
context.
específicamente, no
So
es
it's
solo el
not
objetivo
specifically telling
dar
us that that is
específicamente la
the
forma de
purpose. So,
adaptarlo, ¿sí?
or the
O de la
way to
adaptabilidad.
adapt it. That's why we
Requiere
call it
tener personal
adaptability.
básicamente entrenado en el manejo
It
de
demands to
evidencia
have
científica, de análisis crítico de
staff that is
información
basically trained in the
médica y
management
tecnologías
of scientific
sanitarias, aunque
evidence,
no se refiere, digamos,
biomedical and
expertos
health
en la
technologies, although
elaboración
no
de evaluaciones de tecnologías
experts are
sanitarias.
required, or it does not
Obviamente,
demand for
si
them to
estamos
be
hablando de algún
experts in
medicamento o
the
tecnología de muy
issuing
alto
of
valor que
HTAs.
no tiene
Um,
evaluaciones ya
if they
realizadas,
have
propuestas, revisiones, pues no es un
technologies that are
informe
very
adecuado
innovative
para ser
and
adaptado,
and
entonces en
these
este caso
evaluations,
no
then it's
sería
not going
obviamente
to be
útil.
an important if it
Y
is
no
may not be
abordamos
that
tampoco los
useful.
aspectos
And we didn't
económicos. Sí
address the
tenemos
economic
otros instrumentos
aspects
como
either.
quizás
There are some
para
other
intentar o no
tools or
transferir
instruments
evaluaciones
to
económicas, pero
be
no están en
able
el
to be
marco del
used
criterio
in the
técnico.
transference of economic evaluations, but it's not contained within the
¿Cómo nos
framework of our
parece?
tool.
Y por eso agradecemos mucho al secretariado de
What do
RedETSA
we think?
la
And we
invitación y
want
de
to
poder
thank the
compartir, como decía
Secretariat
Alexandre,
of
esta
RedETSA and the
herramienta
opportunity to share
nuevamente
these
con
tools, as
ustedes,
Alexandre
porque
had
creemos
said.
que para seguir,
We
bueno, hace falta
notice that
difundirla,
to
usarla
continue,
no
we
solo
still have
no
to
de manera errónea,
convey a
sino
little bit
con
more
toda
of it, to
intención ponemos
disclose a little
usar,
bit more
usar,
of it.
usar, porque
It's not
consideramos que
a
realmente
typo there
el
when
uso
we
que
write
pretendemos que ustedes la
use,
puedan
because
usar en sus lugares de
we're trying
trabajo, en
to
sus
emphasize
agencias
it. We
de
want you guys
evaluación,
to use it
ponerlas en
in your
práctica y
evaluation
poder
agencies, to
retroalimentarla
practice it, to
al
be able
equipo
to provide a
de
feedback
comentarios,
to the
sugerencias
team in terms of
o
comments,
cambios en
suggestions,
alguna de las
or
preguntas o en la
changes
estructura
in
de la
any of
herramienta
the
que
questions
consideren.
in the
Este año,
structure of the tool that
como
you may
muchos de ustedes
consider.
saben,
This year,
en
as
el
many
encuentro
of you
RedETSA que se
know,
hizo en Buenos
in
Aires,
the
tuvimos
RedETSA
la
meeting we had
oportunidad
in
de
Buenos
tener un
Aires, we had
taller.
the opportunity
La
to
herramienta fue muy
conduct
bien
a
recibida
workshop
porque
where the
quienes
tool was
participaron en el taller nos
nicely
hicieron algunos comentarios que
received and
publicamos en
understood.
consideración.
And we also received some
Pero bueno,
comments during the
nos
workshop
interesa
that
eso, que
are still
ustedes
under
puedan
consideration. But that's our
analizarla, la
interest,
encuentran
that
disponible
you're
en el
able to
sitio web
analyze
de
it. You'll
RedETSA y
find it
también en
available
el
in the
chat se ha
RedETSA
puesto algún
website,
link
and in
directo
the
a
chat,
a
you'll
esa
find
herramienta
a
y
direct
en el
link
uso
into
nos
the
pueden
tool.
escribir o
And
consultar
then
tanto a
you
nosotros
can
como
write to
al
us
secretariado de
about
RedETSA
it in terms
para
of
poder hacer
the
los cambios
use
que
so
ustedes
that we
consideren.
can make all the changes that you may need.
Sin más, les queremos agradecer. Ahí
And
tienen
so with that,
nuestros
we really
números,
want to
tanto el de
thank you.
Alicia
Those are
como
our
el mío.
contact emails for
Seguramente
Alicia
ahora
and
se los escribiremos
myself.
también por el chat y
And
nos pueden estar
we're going to
escribiendo.
leave them in the
Muchas
chat as
gracias.
well, and you can write to us anytime. Thank you so much.
Muchísimas gracias, Alicia y Cristian,
Thank
por sus
you, Alicia
presentaciones,
and
por
Christian,
supuesto,
for
por dar a
your
conocer en mayor
presentations and
profundidad
also for
una
delving
herramienta tan
further
importante que
into
puede
this very
permitir
important
agilizar
tool
la
that
toma de
can
decisiones en
allow
salud en los
the
tiempos actuales donde, bueno, el
decision
tiempo
making
apremia,
in
¿no? Y bueno,
elements of
nuestras
healthcare when time is so important. Our congratulations to the RedETSA team on the adaptation of the HTA's report. Perla, thank you as well. With Ana Perez, that were the most important promoters of this team. Go ahead, Perla. Can I make a comment? I would like to emphasize something very important that Christian brought up. when talking about the modules, we notice that module 3 is the only that is analyzing feasibility. But previously, there are other two modules that are paramount for the use of the technology, which are the ones Christian mentioned in modules 1 and 2, where we can see where we study the authors, if there is any conflict of interest, and many other sets of data, and then the methodological part, meaning if efficacy has been studied, important output of segregated output, etc. And I'm not going to repeat that, but module 2 is extremely important. So just module 3 is visibility. Let's not make a mistake. This isn't a tool for feasibility of a report. I just wanted to emphasize on that. Thank you, Marlon, and congratulations for the work done.
Gracias a vos, Perla. Gracias por tu comentario.
Thank you,
Bueno,
Bella.
antes de
Thank you for your
continuar,
comment.
quiero recordarles que pueden dejar
Before we
sus
continue, I
preguntas
want to
en la
remind you
cajita
that you
de
can leave your
preguntas y
questions
respuestas
in the
que tienen
Q&A
abajo,
session you have
Q&A.
below.
Y en esta segunda sección
And
se
in this
presentará el
second
reporte
session,
elaborado
we're
cuyo
going
archivo está
to
en español,
submit
porque
the
por ahora tenemos la
report
versión
with
en
the
inglés,
Spanish subtitle. We
próximamente
just have
tendremos
the
la español.
English
Hemos
version.
resuelto
We'll have the
tecnologías
Spanish very
sanitarias
soon.
en hospitales para América Latina y el
Health
Caribe,
technology
casos
assessment
prácticos
for
para
Latin
unidades
America
de
and the Caribbean,
evaluación de
practical
tecnologías
steps
sanitarias
for
en
the
hospitales.
units of
Hemos
assessment
trabajado
of
estos últimos años
HTS
desde
in
2012 en el
hospitals.
Instituto Nacional de
We've worked during
Cardiología de
this
Brasil
time
con el
with
equipo de
the
Marisa
National Institute of
Santos para
Cardiology
poder
in
brindar
Brazil with
este
the team of
documento
Marisa
sencillo y
Santos to be
práctico
able
que
to
describe un
bring
poco la
this
situación
practical
actual
and
de la
simple
ETS en los hospitales
document
de
that
nuestra
explains a
región,
little bit of
pero
the
que
current
también contiene
situation of
información
HTAs in the
práctica
region,
clave
but
para
it
el
also
desarrollo de
contains
esta disciplina
practical and
en
key
los
information for
hospitales.
the
Bueno,
development of
Marisa
this
es
tool in
médica,
hospitals.
doctora en epidemiología,
Marisa is a
especialista en
physician
evaluación
and
de tecnologías
doctor in
sanitarias.
epidemiology
También tiene
and
muchos años de
HTA's
experiencia en la
expert
coordinación del
with many
núcleo
years
de
of
ETS
experience in the
del Instituto
coordination of
Nacional de
HTA's
Cardiología de Brasil y
n-
actualmente es profesora de
groups
posgrado en la
in
Nación de
Brazil,
Tecnologías
and she
Sanitarias del
is
Instituto Nacional de
finishing her
Cardiología de
PH
Brasil.
in the
Adelante,
National
Marisa,
Institute of
piso tuyo, muchas
Cardiology
gracias
for
por estar acá.
HTS. Thank you, Marisa. Go ahead. Thank you, Marlon. Please confirm that you
Sí,
can
estoy
see
viendo
well.
perfectamente tu
Yes, I can see
pantalla
your
y
screen
aprovecho
perfectly.
todo para los que no
And I
sabemos
want to take the
portugués
opportunity
o no lo
that for
quieren
all of
practicar
you
hoy,
that don't
que
speak
pueden
Portuguese or don't
aprovechar
feel
la
like practicing
interpretación.
it today, you can take the opportunity with the interpretation. I promise to speak a little slower with the consideration to our interpreters. I'd like to thank the invitation to PAHO, and I also want to thank those that helped into the creating of this document. And I initially want to thank at Rosanna and Alex from the National Institute of Cardiology team who directly work in the putting together of the text and the wording of the text, Vane, Flavia, Caroline from PAHO that helped in the revision process. So it was quite a swift process, in spite of a lot of work with a lot of going and coming. It was still quite a quick process, and I felt very satisfied with that partnership and that interaction because the wording process is not always that easy. So I wanted to talk a little bit about that context where the document was created within. So I started working in HTS within a hospital setting. It was a third level in the National Institute of Cardiology, and Brazilian agency of HTS was created based on the idea of a look into a sentinel event that in our case, when we were evaluating adverse events and sentinel events, is conducted to an HTA to look into the same logic by using this tool in many hospitals as HTA hubs. So it came a group that was created with Lisandro Group, who was very encouraging. He's the one who invited me to work in this area of HTS. So from that first moment, we started always working with a perspective both from the hospital setting as the country as a whole. And to us, it was very clear that there were important differences and that some methods needed to be tailored, adapted. So it was back then when I started to partake from international conferences, when I was able to meet Laura Samper Colon, who is an inspiration to all of us. And I also worked together with a team in Brazil and the HTS of hospitals in Brazil. And we also started to find interest in these topics. And of course, it's not easy. It is quite a challenging process, particularly because of political issues within hospitals, that technically is not as difficult, but to be able to conduct these partnerships and to be able to go beyond those structures of power within the hospital, it's not a simple process. So, as Malin already said, this initial document is in English. That's why we've kept our slides in English. But the plan is to have a Spanish version very soon. Okay, so what are the differences that we found between the national process and the local process within hospitals? So the first objective in the issuing of this is a little bit different, because one of them is that it is created for the country, working mainly in this idea of reimbursement, a certain technology, a certain procedure. So obviously, in addition to efficacy and security, which is very important, of course, there are certain economic aspects that are quite important looking into the country's sustainability. So when projects are discussed within a local context, then in comes this idea of a lower usage, a bit more restricted of technologies. So then, obviously, some elements will have a greater importance than others. So the standpoint of decision makers will be different to the expertise. It will be different to what's been looked into with the national agency. And so, as I said, this government's perspective, these prices would be different. We're going to have specific prices that have to do with the country. Comparisons will be different as well, like in the case of Brazil, when we have buyers that are adapted within the public healthcare system. And in the case of the hospital, both prices and buyers will be the ones that are going to work within that hospital unit. So the time available for the wording of these documents vary usually. So in Brazil, we're working with a horizon that takes between 3 to 6 months for the with the wording of the economic model and all the search.
Habitualmente de decisões mais rápidas, né? Vai tomar a decisão, elaborar
This decision will be made, will be created normally in 30 days. So the national decisions we will have an impact in the entire country, and the decisions within the hospital, regardless of the fact that we might have some externalities, basically will have an effect only within said unit. And of course, depending on the characteristic of the unit, many units, many hospital units, there are hospitals and schools, right? They have teaching and research very strong at the unit. And at these units, innovation has a much greater importance than in scenarios in the country. Of course, because innovation is valued within the country, but this valuation within the hospital decision making is much greater, and it's important for this to reflect these aspects so that we can have all the necessary information. Within the country, we work with cost effectiveness and limits of cost effectiveness, of course, in most countries, and assessment of the impacts on the budget. With a great novelty this year in Brazil, our decision-making body, which is called CONITEC, is working on the Vânia Canuto work with a creation also of a study for budgetary impact. And within the hospital, we currently only work with a budgetary impact within the budget of the hospital. Of course, looking for the sustainability of this unit, and this, of course, is also a very important point to be assessed. From the national point of view, then, we generally do a full report, and within this hospital, the greatest part of the reports are faster reports. And in regards to the team, as it was mentioned, the idea of this document is to have a practical document mainly for those who are just starting. Many people were looking for me last month. There was a group of a university in Rio de Janeiro that wanted to create a unit, wanted to know how to work on this, and I sent them this guideline. So the people who are going to work at the unit, at the technologies assessment unit, it's desirable, it's not mandatory. People can be trained, but it's desirable to have some sort of background or previous experience to facilitate their work. The work of technologies assessment is already hard enough and broad enough. So I see myself having to deal with specialists from a team for radiotherapy to all the way to a medication or for any other issue. So this is difficult work where we need to study, we need to learn a lot of things, methods change so much, and therefore it's important for people to have this background, to have this knowledge, first in epidemiology, to be able to do evidence assessment and assessment of the quality of the clinical tests. And this point of evidence quality assessment is very important, not only for clinical tests, but also diagnostic tests for meta-analysis. And also, more and more, we're working with studies that are single arm and they're observational evidence. So it's important, therefore, to learn about all of these assessment methods for the quality of evidence. Being able to do the search in the literature in my unit, we have the support of librarians, but it's also important to have autonomy for the elaboration of these searches and to have a basic knowledge on statistics. It's not necessary to be a statistician or to have a statistician at the unit. We can work with alliances with other units, but some previous knowledge on statistics can be helpful. Having gone through a statistics career is also something that is interesting for previous experience. Being trained or already having specific knowledge on the area of technology assessment is also important. So, how do we create a report? It can seem simple. We take everything that we've already seen here on evidence. We take the budget calculation impact, the budget impact calculation, but I say this is a science and we need to be technically correct. And we also need to write in a simple language. So it's very important for these reports, for me to know that this is not for me. This is not to do a publication. This report is for the group that will be making the decision on the adoption or not of said technology. So we have the administrator that needs to be able to read, the nurse, the physical therapist, anybody who is a part of this team needs to be able to read a report and understand. So we need a simple executive summary that is also quick and that many times it will be determining the decision. Therefore, people need to learn to work with a pool of evidence. It's not just the quality of individual evidence. This is a much simpler process. But since I'm putting together all this group of evidence that I already located to be able to do a summary, and here we work with the GREAT method, both mainly for clinical trials. So it's a method that's also adopted in the country that creates a table and simplifies, demonstrating how this set of evidence was interpreted by the team of these allies, and they need to know how to calculate the budgetary impact within the hospital. Next year, Brazil will be publishing a new guideline of budgetary impact, and our expectation is also that we have some limits of budgetary impacts. And we need to know how to communicate also with the several teams, for example, communicating the results of this and also disseminating the work is also a very important point. Many times that is not taken into consideration. It is possible to start. Is it possible to start on our own? Well, yes. I started at the unit on my own, but it's so much harder, undoubtedly. As of the moment that I could have a greater team, and the quality of the work grew exponentially, and being on our own, we have a lot of difficulties, but maybe the most important point of this guideline is that at least one person should have exclusive dedication for the assessment of technologies. As I already mentioned, this is a process that is not simple. We need to study it a lot. We need to learn about many things, and we need to have this exclusive dedication, and this is very important. Ideally, this person should be an epidemiologist, or there's other professionals, provided that they have epidemiology training. This is also interesting, and we can have alliances with other units of the hospital. For example, if we had an epidemiology unit, we have a unit of statistics. It helps us a lot, librarians, and with the people who are here at the top with the physicians and the nurses and the engineers also. So these are the people who are going to help our work to always be a part of the reality of the hospital. And another important indication is to have interns, to have students on scientific initiation, maybe alliances with universities. So this helps work a lot. They bring in new ideas, and it's very important, therefore, to have these alliances to be able to have access to these interns. Additional to this, these hospital alliances with an agency or a unit of the country that elaborates these opinions that are important in the decision in the country are very useful. The hospital unit, for example, can help provide input and create models and disseminate the information, and the agency can help with reports that will also help a lot in the drafting of these reports of the hospital, to do networking, to get to know other professionals and learning with other experiences, what worked, what didn't. And I always say that sometimes an experience that didn't go well is so much more useful than one that did. Training, for example, in Brazil, we have many training sessions that are offered free of charge online for this network of technology assessment that we call FEBRIT. And this alliance also with RedETSA, with the colleagues from Latin America, is very interesting. And we had the opportunity to always learn so many things and bring data on effectiveness, for example, and safety. The hospital is a unit that many times we see as having security problems. They're not there, they're not maybe drafted. Therefore, this feedback as a hospital unit increases a lot for the national agency. So, it's an HTA unit is not expensive. We have very basic needs: access to data banks, ideally data banks of the hospital and the country, banks of evidence, where we achieve evidence access, for example. And this creates something that seems a lot more elaborated and interesting. It's not so simple. It's interesting if we have the opportunities. And there are some resources that are monetary for training and communication. And we have a website that we disseminate, or where we disseminate the projects and the things that we're creating. And we also create a framework, a local framework. And it's important also to have a process that is organized, preferably a local guideline of how we do HTA in my hospital. This should be, this has been published for everyone, both for decision makers as well as for the technology assessment unit, and that they could follow an organized process. But the most important thing, I would say the hardest one, is to have a team that is motivated and that has talents. So it's very important. As I mentioned, I started on my own, and I started locating people that had talents that could help in the operation of the unit. So students are very important to stay updated and to bring motivation. So these are the drafting processes that need to seem, or that generated to publications, and this is a technical publication. It didn't talk about the process.
But we did inquire with credit with members in Latin America and the Caribbean about how the process was in the hospital. We also looked into the review of scope that is published in PAHO magazine about this process of publications that described this process of HDS in hospital in Latin America and the Caribbean.
Bem,
Okay,
para finalizar, alguns
to conclude,
desafios, né?
some
Então,
of the
como eu falei,
challenges
ter as
existing,
equipes
just
com
as I say, there
multivares e com
are
dedicação
teams that
exclusiva
have
sempre
specific
é um
approaches,
desafio, né?
and it is
Muitas vezes
always
essas
a
pessoas
challenge
são
because oftentimes
capturadas pela
these
indústria
are people that are
farmacêutica,
captured
né? Que
by
habitualmente
the
paga mais
pharma
do que
industry that
os
sometimes pays
hospitais,
more
né?
than
Então,
hospitals.
essa
So
rotatividade
that
é
kind of
frequente e aí
turnover may be
muitas vezes
frequent
entra uma
in that
pessoa
area. And oftentimes
jovem
also,
com
this is a
pouco
young
conhecimento
person
e
that
pouco
that may
treinamento,
not have as
tanto
much
da
knowledge or
parte
training,
das pessoas do
both
hospital
from
quanto as
hospitals,
pessoas que tomam
hospital teams,
decisão.
as those that are in
Então,
decision making.
é
So
importante
it is very important
convencer o
to be
hospital
able to
que
convince the
precisa ter
hospitals that they
verbas e
need to
precisa de
look
pessoas, né?
into
Sem essas
the
pessoas
training of people
motivadas e
and to
com
have these
uma
people that are
formação adequada, é
motivated, that have the
impossível
proper
fazer o
training,
trabalho.
and
Outro desafio
that are
grande é
more
integrar
capable to
esse
perform the work.
processo de avaliação
Another
de
challenge here
tecnologias
is to be
mais
able to
formal
integrate these
dentro
HTA
do
process in a
processo
more
do
formal
hospital.
manner within the
Então,
process of the
o que
hospital.
pode ajudar isso?
It can
Primeiro é
help,
que a gente não pode vir com o
first of all,
processo
if
de fora, né? Então, a gente tem que
people are working with this
pegar
process
o
from
nosso
within, not
processo e
from
adaptar
outside. So they have
dentro da
to be able to look
característica do
into how to
hospital.
adapt
Então,
this
para isso
process
ajuda ter
with the
uma
very
política,
hospitals
uma diretriz
characteristics in
explícita,
reality. So it has to
pactuada
have a
com a direção
specific
alta,
guideline
gestão do
that has been
hospital,
agreed
e ter
upon
processo
with the whole
contínuo de
management. So it's a
educação
constant and
e
continuous process
treinamento
of
para que as pessoas do
education and
hospital
training
entendam
so that
a
those that are
importância. Muitas vezes as
starting to
pessoas
work with
acham
this
que
understand
a
what's the importance.
unidade de
Oftentimes
avaliação
people
de
feel that
tecnologias é que vai
HCA
decidir
units are the
se
ones
o
that are going to
catéter vai
decide
ser
either where a
comprado ou
catheter
não.
is going
Então,
to be
não é
purchased or
essa a
not, but
ideia,
that's
né?
not the
Então, é
idea.
importante
So it's
frisar
very important
que
to
quem faz a avaliação não é
emphasize
quem
that those
decide.
that make the
Muitas
assessment, the
vezes a
evaluation, are
gente tem
not the ones that make
falta
decision.
de dados
Oftentimes we
locais,
lack
né? E
local
aí é
data,
importante que a
and it is very
unidade
important here
estimule essa
to have the
geração de
unit
dados
to
locais, né?
stimulate the
Então, muitas
collecting of
vezes nós
local data.
fazemos uma incorporação
Oftentimes it's easier to bring
temporária,
a
né, para
temporary
uma revisão no
incorporation
futuro,
with
por
a
exemplo, quando existe uma dúvida
local revision
sobre
than if we project it
como
into the
vai
future,
ser
like
o
if we
treinamento, como é que vai
don't
ser
know how the
disponibilizado
training is
dentro
going
da
to
minha
be or
unidade, porque
how
é um
is going to
procedimento
be the
mais
result within our
complexo,
unit
ou em
that
relação ao
may
volume de
require a lot more
gastos, né? Então
complex
você pode fazer
training,
essa
etc. So
incorporação
that you
e
can
rever,
bring
por
this
exemplo,
incorporation
dentro
and
de um ano,
look it
como
into
foram os resultados
within a
daquela
year to
nova
check what the
tecnologia.
results, how the results behaved of that
Então,
new technology.
está aqui disponível para vocês. A
So
Mari já,
this guide
já
is
mandou o
available for
link
you guys.
também,
We've
né?
already sent
E
a
chamar a
link.
atenção para vocês que o
And so I'm
mais
just going to call your
importante
attention
é
of
essa
what's more
parte
important, which
realmente
is this
mais prática
part and
de
the red square
institucionalização
and the
da unidade de
institutionalization of the
ATS
HTA
hospitalar e
units
de
in
como
hospitals
é
and
o
how
processo com
a
essas
process is,
relações
how is
dentro
that
do hospital
interaction
e
within the
fora
hospital
do hospital.
and outside the hospital as
Bem,
well.
eu deixo o
Okay,
link,
and so with
né?
that, I'm
Nós
going to
estamos
leave
já
that
há
link to
ano
you.
com o
We've
nosso
been working
doutorado em
for
avaliação
1 year
tecnologias, já
in our
nesse momento no
PH
processo
of
seletivo,
HTS.
e
We
tem
are in
sido
this
muito
selective
interessante
process.
também para a gente
And it's very
elaborar
important also and very
trabalhar
interesting for us to be able
com
to work
propostas de
with
métodos mais
the
inovadoras, com
purpose of more
estudos
innovative
mais
methods
longos.
with
Eu
longer
estou
studies.
disponível aqui
And so I will be
para
available here
perguntas e
for any questions you
sugestões.
may have.
Muchísimas gracias, Marisa, por tu excelente
Thank you very much,
presentación y,
Marisa, for
bueno, tu
your excellent
compromiso en colaborar
presentation and
siempre
your
con RedETSA en
commitment
esta
to
temática
always
tan
work
importante
together in
también
RedETSA
para
for
nuestra
this
región.
very important topic for
Bueno,
our region.
ahora tendremos un espacio
Well, we
final
have
de
a
preguntas del público.
short
También
time
invito a
for
Alicia a abrir
Q&A from our
su cámara.
audience, and my invitation is for my
Hay muchas
speakers to open
felicitaciones y
your cameras.
Excelentes presentaciones.
We read a lot of
en
congratulations
el chat.
and excellent
También algunas
presentations in the
preguntas.
chat section
Si
and
les
also
parece,
some
podemos
questions.
empezar con las de
So
la
if you don't
carta,
mind,
mientras también van
we can
escribiendo otras.
look into this that we already
Me
have.
pregunta Rosa Anónima esta pregunta
Okay, we
sobre
have an
la,
anonymous
sobre la
question
herramienta de adaptación.
on
¿Qué
the
pasa si en el
adaptation
módulo
tool.
1
What
se
happens
responden
if
como
module
parcialmente?
1
¿Tampoco
you have
continuamos y
answers
buscamos
as
mejor otro
partially?
informe?
Should we then
Si te parece,
stop and
Cristian,
try and find
contesto.
another report?
Sí, sí.
If you don't mind, Christian, I
No,
would
la
like to
idea de
answer.
esto también
Okay, so
depende
the
de cuánta
idea
certeza
here
cada
also
uno
depends
que
on
realiza o va
the
a realizar una
certainty
adaptación
for those of
quiera
us
tener.
or
En
those of
muchos
you
casos,
who are going
lo
to
que
make an
exige es una
adaptation.
evaluación de tecnología en la
Oftentimes,
que la
what we have
mayoría o
is
algunas
an
partes de esa
HTA
pregunta
where
es
most of the questions
no es sí.
have an answer that
Esas
is different
depende
to
de la
yes.
decisión de quien la está
So it
mirando.
depends on the
Pretende
decision of
adaptar,
those of you
pero
who are reading
sabiendo
or
de
intends to adapt
antemano
the
que si
guide,
no dice
but knowing
sí,
beforehand that if
pero
it's not a
será no.
yes, then
Entonces, en
doubts
realidad,
come to
lo
mind.
ideal es
So
que si
what's
esas
ideal
cinco, a
here
esas
is
cinco
that
preguntas se le
the answer
conteste
to
sí.
those 5
Uno podrá
questions are
flexibilizar de
yes.
acuerdo a lo que cada
You
uno
may be as
quiera,
flexible
pero en
as you
realidad
want to
lo
be.
deseable es que
But
las cinco
the
se
truth is
contesten
that
bien.
what's
Porque
desirable
si
here
tengo
is that you have a
dudas,
yes
tengo
for
dudas,
all
así
5
que
questions.
prefiero.
Because if I have a doubt, then
Exacto.
there's
Y
a
ahí
doubt,
capaz
obviously.
algo para sumar, Malena, digo,
Yes, and something
como
that
dice
I may
Alicia,
add,
quizás
as Alicia
ustedes en la
said,
herramienta de hecho lo van a
Milan, is
poder
that
ver,
maybe
que
you'll be able to see
como
it
les
in the tool as
mencionábamos,
well,
si por,
as we've
de otra
mentioned,
manera, si todas se contestan
is that
con
if
no,
they're
ahí es
all having
claramente
a
cuando dice, bueno,
no
todas
as an
contesten con no,
answer,
no continúen.
then
Pero
that
como dice
clearly
Alicia,
tells you
la
that you
herramienta no
cannot continue. But
pretende
like Alicia
ser
said,
una
the
herramienta,
tool
digamos,
is not looking
completamente
to be
estricta de dar un
a
score o un
very
punto de
strict
corte o decir, bueno,
tool to
qué es
give you a
lo que hay
cutting
que hacer
point or a
si
score
sucede o si
and
contesto esto sí o no
telling you
parcialmente,
what you
sino
have
es
to do
una
if you
herramienta
have
de
a yes,
apoyo
no, or
para
partially. It
que
is a
eso,
support
digamos, en
tool
la totalidad del
so
análisis
that
crítico que
in
se
the
está haciendo
whole
de
of
ese
the critical
informe y
analysis
que
being
tiene cada
conducted for that
agencia
report
y en ese
and that
marco
it is in
pueda
the
tomar una
hand of
decisión.
every
Entonces,
agency,
y a
then
la vez,
you can
de
make a
las mismas
decision.
5 preguntas,
And
también
at the same
puede después
time, out
cada
of those
agencia
5
verá
questions,
que no, o
each
sea, todas
agency
son
will
muy
be
similares,
able
pero
to
quizás alguna
see, and
tiene
they're
alguna
all very
razón
similar, but
más
maybe
importante para
some of them
determinar
have
que
a more
otra.
important
Entonces, esa decisión
institutional
también le queda
importance than others.
flexibiliza
So that's a
la
decision that
herramienta,
is
pero sí es
also going
importante
to
capaz
stay
eso, que no
to
es,
s-
digamos, un
stay there
score para
for
decir,
those of
bueno,
you
este es
who
el
have
punto
to
que me
make a
dio
decision. But it's
o
not a
demás. Es súper
score.
interesante la
So
pregunta,
it's
pero bueno,
very
queda
super,
mucho
it's
al
very
análisis
interesting,
crítico
your
de quien
question, but it's
está
all very much to the
evaluando.
critical
Ese,
analysis of those that
digamos,
are
el
assessing
usuario
the
final que tiene que tomar
usefulness
la
of that
decisión.
HDA. And it's the final
Es
user, the
hasta
one
incluso en la
that
guía
has to
para
make the
alquilar.
decision.
Lo que refiero es que uno puede
And it
encontrar
could
más de
also
una
be
respuesta.
in the comparison.
Exacto.
So you can
La
have more
tecnología
than
que
one
uno
report
pretende
for the
adaptar. Y puedes
technology
encontrar
that
más
you
de
are
una
looking to
respuesta.
adapt. You may
Acá
find more than
miran y
one
digan
report.
todos sí.
So the ideal here is that you have a yes for all of the
La
questions.
flexibilidad dependerá de quién
So
De cada
utilice la
flexibility is
herramienta,
something
pero
that's
teniendo en
up
Y
cuenta
to
del
each
objetivo
user.
también, ¿no? Del
And the
objetivo con el que
objective
luego
as
van a
well, the
hacer
objective
esa
that
adaptación,
that
adaptabilidad.
adaptation is going to be conducted for.
y puede haber informes que sean mejores que otros, claro, perdón. Sí, sí, Carla,
Claro, por
adelante.
otra parte, es muy
On the other
importante
hand,
porque, por ejemplo, si
it
nos
is
encontramos
very
con
important because if we encounter, let's say, a
donde los
report
trabajos en los cuales se
where
basa
the work that is based
no
on
tienen en cuenta
does not
efectividad
consider
para
effectiveness
desenlaces importantes
or
o
important
además tiene conflictos de
results or
interés,
outputs,
porque
or
parte
if
de
it
toda
also
la
it also has
metodología
conflicts of
la
interest because
realiza
maybe the whole
alguna compañía
methodology
farmacéutica,
is being
etcétera.
conducted by
Hay
a
preguntas que son
pharma company,
claves.
etc., then there are questions that are
Si
key.
no están contestadas
And if
esas,
then
por más que
these
sea
questions are
una
not
sola,
answered, even if it's just
directamente
one,
descartamos y no pasamos a
we
la
will immediately rule it
transferibilidad.
out and
Por
we
eso
don't move
cada
into
una de esas
transferability.
etapas
That's why
tiene
each
suma
of these phases
importancia. Por eso
are
podríamos
very
decir
important.
que
That's
esto
why we could
no
say
es una
that
herramienta
this
de
isn't just a
factibilidad,
feasibility
sino
tool,
que
but
para adaptar el informe tiene en
in
cuenta
order to
esos
adapt
tres
the report,
módulos,
you
no
need to
solo el de
consider those
factibilidad.
three
El de
modules, not only
factibilidad se
feasibility.
hace cuando
Feasibility
los otros
is one that you
llenan los
conduct when
requisitos
the others
necesarios, que
fulfill the
probablemente no
needed
sea el
requirements.
100% de
That
lo que se
maybe is not the
requiere ahí,
100%
pero
of
hay
what's
puntos
being
claves.
said there, but there are key points.
Bueno, Pensando que solo nos quedan
Okay,
unos pocos
since we
minutos
just
y
have like a
tenemos
few
varias
minutes and we
preguntas,
have
lo único que
several
les voy a
questions,
pedir es que
all
intentemos
I'm
ser
going to
más
ask you
concisas en las
is
respuestas,
that
así
we need
logramos
to try to
no
be more
dejar
concise in our
todas las
answers.
preguntas
That
afuera,
way,
¿sí?
we don't have to leave as many
Entonces,
answers,
la herramienta de
as many questions
adaptación
out. Another
consulta
question,
impreso,
for
mano
the
cincuenta,
adaptation
papel,
tool,
digital, web,
how do
en
we
tiempo
find it?
real con otros
In
centros de
paper,
RedETSA.
digital, and the
Ahí simplemente
website
para,
in
si
real
quieren, para
time with
mencionar,
other
esta
RedETSA
es un
centers?
PDF, digamos, se
It's
descarga
just a
desde el
PDF.
sitio
You
web de
just upload it
RedETSA,
from
ya está
RedETSA's
publicado en PDF,
website.
pero me
So it's
parece,
published in a
personalmente me parece
PDF.
interesante esta idea.
I
Bueno,
think
no tenemos tiempo para
this
ponerla
idea
porque es muy
is very
interesante esto de que
interesting,
pudiera ser en tiempo real
and
lo
it's
demás.
interesting that we could
Por ahora
look
lo
at
tenemos en
it
PDF como
if
una
it's in real time or
publicación.
not. But so far, we have it in PDF as a
Excelente, sí.
publication.
Y bueno, para los que les gusta hacer en
Okay,
papel,
and
lo
so
pueden
for
imprimir.
those of you who like paper, you can
Cómodo.
print it out. Sometimes it's more comfortable.
Excelente.
Nosotros la
Bueno, acá hay una pregunta.
utilizamos en un Excel, solo eso, en el taller la utilizamos en un
At the
Excel.
workshop, we just
Que,
worked
bueno,
with it in an
podemos
Excel sheet.
enviárselo si ustedes
You
quieren,
can
pero
send
son-
it to
es
you
muy
if you want.
sencillo hacer un
But it's
Excel
very
en el
simple.
cual uno pone y
It's just an
se
Excel,
laburan.
an Excel sheet.
También, en la próxima, se me ocurre que en la próxima revisión
Maybe in
podríamos
the next
agregar en el
review, we could
propio,
add
en la propia herramienta como
link.
in the
un
very
link de
tool
descarga de un Excel,
like a
como
download
para que uno
link
también lo
for
pueda
an Excel
usar.
so that
Es
you can
buena
also
idea,
use
me
it there.
gustó.
Sí.
Very good idea.
Bueno, algo más para, para anotar. Bien, otra consulta antes de
Another
pasar a los
question,
hospitales, preguntan.
before
Bueno, esto es
going
un
to
tema un poco
hospitals
muy
HTA,
especial para de un país,
this is very
pero
specific for a
quizás
country,
pueden
but
apoyar. Considerando
maybe
que
we
la
can help.
fragmentación y la
Considering
duplicación
the
de las
fragmentation and
HTS en los
duplication of
subsistemas de la red
HTS
pública
in the
integral de salud de
subsystems of the
Ecuador
comprehensive
dilata
public
el acceso
network
oportuno a la innovación,
of
¿qué
healthcare in
mecanismos de
Ecuador
implementación
may delay the
legales,
access to
regulatorios y
innovation in a timely
operativos
manner, then
deben
what
formalizar el Ministerio de
implementation
Salud Pública
mechanisms you
y las
consider
autoridades
the Ministry of
financiadoras para
Public Health
establecer
should
un marco
formalize together
reglas
with
institucional
funding
que
authorities to
garantice el
establish a
reconocimiento cruzado del
institutional
HTS
reliance
de la ITS
framework
en
that
hospitales
can
también,
guarantee the
ser
cross
realizadas por
recognition of
cualquier
HTAs in
ecosistema
hospitals to be conducted
de
by
salud
any ecosystem
del
in
país.
the healthcare
Y
system of the country.
adicionalmente, ¿cómo se
And
puede
additionally,
institucionalizar
how can the
acá está.
systematic
El uso
use of the
sistemático
tool
de la
be
herramienta para la adaptación
institutionalized
de
for
informes de ETS
the
de RedETSA
adaptation of
enfatizando el módulo 3 de
HTA reports of
factibilidad
RedETSA,
para asegurar la evidencia
emphasizing
clínica y
Module 3,
económica,
disability,
validando su
to
relevancia
ensure
y
clinical
aplicabilidad
and
al
economic
contexto
evidence and
organizacional,
to
social y de
validate
recursos y
its relevance and
presupuestarios
application
específico de
into
Ecuador,
the
logrando el
organizational
ingreso de nuevas
context
tecnologías a los
in
pacientes.
Ecuador, achieving the incoming of new
Difícil esa
technologies
pregunta.
for the patient. Oh my God, that question is
Sí.
very difficult.
No, yo puedo comentar sobre la primera
I
parte.
can comment a
es
bit about the
cómo-
first part,
ese ha
which
sido un
is
problema de muchos países del
that
mundo.
honestly
Tiene
that
que ver
has
con
been the
las
problem
redes
of many
internas,
countries
y
in
lo
the world, and it
único
has to do
tiene
with
que
the
ver con
internal
las
networks,
redes internas
if I'm
que
able to
hacen
understand what it was
evaluaciones.
asked. And it
Entonces,
has
en
to do with the
realidad,
internal networks that
no se
actually
observa la
conduct the
constitución de una
HTAs.
red
So the
interna, es lo que
constitution of
detiene
an
todo.
internal
Ahora,
network,
eso
that
le
is
llevó
what should be worked
años
with.
a algunos
Now, that
países del
took many
mundo.
years for many
Y me
countries in
acuerdo
the
el
world.
ejemplo así solo
And I
de
remember the
España.
example
España
of
demoró
Spain,
mucho
that's
que
the one that
todas sus
comes to mind.
autonomías que
Spain took a
tienen
long
grupos
time
tengan una red.
for
En
all
su
the
momento,
groups that have
recuerdo yo
autonomy
haber
to actually
buscado
have a
en
network.
reportes de
I
la
remember that at a
Wikipedia y haber
certain time
encontrado
I had
más de
to
un
search
grupo
for
español que
HTAs and
ya habían
found
hecho el mismo
more than
reporte.
one Spanish
Sin
team
embargo,
that had created the
eso
same
es casi como
report.
una negociación
But
interna.
that seems to me
No
as
tengo,
an internal
no tengo
negotiation
elementos.
rather.
Pero
I
En
don't
algunos
have
países
elements to hold on
hay
to.
leyes. Por ejemplo, en el
And in
caso,
some
recuerdo,
cases, there are
RedETSA en
laws. I
Perú, que hay
remember
una
in
ley
Peru that they
que
have a
agrupa
law
justamente a las diferentes
that puts
instituciones y
together
hace
the
que
various
los informes de
institutions
evaluación de actividad sanitaria
and
que ellos
makes
elaboran funcionen
HTS that
para
they
todos los
conduct
subsistemas.
to
Pero
work
bueno,
for
hay
all
que
the
trabajar dentro
subsystems.
del país
But it's something
justamente
that
para
needs to
lograr
be
eso.
done
Bueno,
within the
Brasil
country
tiene un
to
excelente
achieve it.
caso también.
In Brazil, they have an
excelente
excellent
ejemplo,
case as
claro.
well. Yes, they
No,
do.
una única cosa y que lo que
And just one
requiere, para mí
thing
que es un elemento
that it
crítico primero, es
requires for me to
confianza.
look into as
Vos
a
tenés que
critical element is
confiar
trust.
que
You
el
need
resto
to
de la gente
trust.
que elabora informes
And for the
sigue la
rest of people
reglamentación
issuing
para los
reports to
efectos.
follow the
Hay que confiar.
regulation, yada, yada.
Si no,
So we
siempre hay
need to
como cierta
trust.
desconfianza. Es uno de los
And there's
elementos
always
que
like a
juegan
lot of that.
críticamente en la elaboración de estas redes.
It's one of the
Y
elements
ahí
that
capaz
has a
sumando a lo
critical
que dice
role
Alicia,
in the
porque coincido, es una
elaboration
pregunta
of these
súper
networks.
interesante
And
como
I agree with what
siento lo
Alicia
mismo, digo,
said. It's
obviamente
very
excede
interesting.
en sí el objetivo y la función en sí de la herramienta, porque
Of
digamos, es
course,
como
it
algo
goes
más propio
beyond
del
the
país que
tools.
es muy interesante y para resolverlo. Pero sí, como dice Alicia, un poco sí la herramienta
So as
trata
Alicia
de
said,
tomar preguntas que lleven a eso,
the
a
tool
tratar de tener
is
o de
trying to
poder
gather all
evaluar
the
la
questions that lead to
transparencia
that
que puede tener un
So
proceso de
to
evaluación de
achieve
tecnologías sanitarias, entonces
transparency,
ese informe, tratar de tener preguntas
that
para evaluar
report
esa
needs
posible
to have questions to
transparencias
evaluate
y
it.
confiar, como dice Alicia, bueno, en esa transferibilidad o en esa
So as
adaptabilidad que se
Alicia
puede
said,
hacer,
in that
pero
adaptability and
con
then
ese objetivo,
transferability
digamos, más
needs
concreto de
transparency.
la evaluación.
Bien, voy a hacer una última pregunta sobre la herramienta de adaptación y pasamos a ETS en hospitales.
So one
Andrea
last
Sanabria
question, and then we
consulta,
go
bueno,
to
agradeció mucho la
hospitals
presentación, la
HTAs.
presentación de la herramienta.
Okay,
Y si
so
existe algún proyecto en el
here's the
futuro que
question: if there is
plantee la
any
combinación
project
de
in
la
the
herramienta
future,
junto con el uso de alguna otra herramienta
together
disponible
with the
para la
use
parte de
of some other
costo-efectividad?
tools that are available for this part of
Es un debe,
competitiveness.
¿no? Es un debe
Sí.
que tenemos y ojalá
This is a
surja
must.
pronto
I
un
hope it
proyecto.
exists,
Este
a
considera
project like that
eficacia y seguridad.
soon
No sé qué
that
opina
considers
Cristian.
Sí,
efficacy
por
and
ahora, exacto,
security.
es algo, digamos,
I don't know what you say,
a considerar
Christian.
también muy interesante, nos gustaría,
We would
pero por
really
ahora
like it.
este,
We
digamos,
have to
como
consider
decíamos,
onto it and
excluye
look into
completamente
it.
y
But so
también
far,
porque, como
it's
hemos
completely
mencionado muchas veces y
excluded.
se ha
And just
discutido
as
en el
we've
grupo,
said several
porque
times,
más
and it's
allá
been
de, como ustedes
discussed in the
conocen, de las
group,
notas técnicas, de los informes,
beyond the
de todas
technical
las herramientas
groups,
o información que hay de
the
posibilidad de
information
transferibilidad, también
tools,
eso
and the
muchas veces es
possibility for
complejo, depende
transferability.
de cada
Oftentimes,
contexto,
it
si no
is complex. It
es muy
depends on
difícil,
the
entonces
context. It's
empezamos
very
por lo que
difficult. So we
capaz es
start
más
with what
digamos,
may be
sencillo en cierta manera, estandarizable.
more
Pero sí es una
standardized.
excelente propuesta, digamos, pero bueno,
But it
sería
is an
como
excellent
para otra
proposal.
reversión del grupo, me parece, Malén.
But then that will require another
Revisiones
meeting.
económicas de herramientas de
And there are
transferibilidad
revisions of
Económica, sí.
transferability tools and
Pero sí,
economic
sería
Sí, sí,
feasibility.
sí.
But yeah, it
Sí,
would be
sí,
great.
tomamos, no tenemos quizás una respuesta, pero sí tomamos
Maybe we
capaz
just
como
don't
para reflexionar
have
en
an
ese
answer for
sentido.
that, but maybe it's a good
Muchísimas
challenge
gracias.
to
No,
work
Y
into that.
hay algunas
Okay, so
preguntas para Marisa,
there are
algunas
some
ya las fue
questions for
contestando Marisa, pero
Marisa
quizás
that
sería
Marisa
bueno
has been
que
answering
podamos
to,
retomarlas
but
entre
maybe
todos
it'd be
en un
great if we
minutito.
could revisit them in a minute
Por ejemplo,
all together. For example,
preguntan Marisa, cuando se hacen las evaluaciones de
they're
tecnologías en
asking
hospitales,
when they
¿utilizan alguna
conduct
metodología específica
HTS in
validada para la
hospital, do
evaluación de
they
costes?
use a specific
Não,
methodology for
o importante
evaluations?
é a
No, what's important
perspectiva.
here is perspective.
Depende da
It's going to
tecnologia.
depend on the
Raras vezes
technology,
fazemos
and very
microcusteio,
rarely do we
porque
work
não
with
é
microcosting
algo muito novo, não se tem
because it's
ideia
something quite
exatamente
new. There isn't
do
a clear
custo,
idea so
mas
far as of the
geralmente fazemos
costs, but we
semelhante ao
usually work
que se
similarly
faz para
to
país, né?
how we do it for the country,
Que é essa perspectiva top-down.
which is to use a top-down
Bien.
perspective.
Después preguntan, ¿qué recomiendas para presentar
Then we have a
Sonia
question,
Gallego?
and
Perdón.
what
¿Qué recomiendas
Sonny
para
Gallego is
presentar
asking,
los
what do you
resultados cuando la
recommend
evidencia
to
está en contra de la
introduce
tecnología
results when the
evaluada?
evidence goes against the technology that is being assessed?
Não existe uma recomendação
There
diferente que se
isn't
faça
a different
diferente
recommendation
entre pareceres positivos ou
that
negativos.
may
O
seem positive
importante
or
é que
negative.
a
What's important
unidade
here
não
is that
deve
the
tomar uma
unit
posição
must not
contra uma
take a
tecnologia.
posture
Esta
against
é
a
uma
technology.
decisão que
This is
cabe a
a
outras
decision that
pessoas, a direção
fits
do
for others,
hospital e outras
the
pessoas
hospital's
em meu
management
hospital
and
fizemos
others in the
comitê
hospital.
para
Like in our
decisão
case, we put
sobre
together a
adoção de
decision committee
tecnologias. Eles
and
devem
technology adoption, so
decidir.
they need
Nós
to
devemos
decide. They need to be the
apresentar
ones
os
deciding
custos,
whether
os
we have to submit
benefícios,
cost benefit,
as incertezas,
if there are
mas a
uncertainties,
unidade não deve
but the
tomar a
unit must
decisão
not
e o
make
parecer
a
não deve ser
decision or
contra a
seem as though
tecnologia.
in charge of
Bien.
decision
Y
making,
por último,
particularly
Catherine
against that
Cerda
technology. And
pregunta,
lastly,
¿cómo sugeriría
Catherine
que
Serda is
podría
asking,
iniciarse el
how
desarrollo
would
de
you
los procesos de
suggest that you
evaluación de
could begin with the
tecnologías en
development
hospitales
of
que actualmente
HTS in
no cuentan con
hospital
una
that
estructura o algún
don't have a
procedimiento
structure
formal de
act
evaluación?
currently or a formal
Ah,
evaluation
eu
procedure?
acho que a primeira
Well,
coisa
I
é se
believe that the first
convencer
thing is
aos
to
líderes,
be
às
able to
pessoas
convince the
que são
leaders, those that
importantes
are
no hospital,
important at the
que
hospital or
é
have a
importante que se tenha
leadership
uma
in the
unidade,
hospital,
porque se o
about the
diretor
importance
for
to have a
contra,
unit, because
não,
if a
não há
director goes against
sentido
it,
se
it
trabalhar
doesn't make
nisso.
sense to
A
work in it.
partir daí,
So from there on, a good idea would be, in addition to have the unit, to try and provide training, and it is important that you also have a specific issue to look into, to ask for the director of a unit or the director of the hospital what are the questions that they may have, to ask them what technologies do you feel that we need to adopt within the hospital, and from there on, you are creating a whole process within the
Excelente,
unit.
Marisa. Bueno, vamos a cerrar
Excellent,
porque
Marisa.
estamos
Okay, we're
pasados
going to
5
close our
minutos.
webinar because we've gone
Agradecemos
5
a todos y a
minutes
todas por
beyond.
su
We want to
participación
thank you
y un
all for
agradecimiento
your
muy especial
participation
a los presentadores
and
de hoy, que la verdad
our
que estuvieron
gratitude to our
excelentes.
presenters today
Este es el
and
último
speakers.
webinario
They
de
were
RedETSA
excellent. This
del
is the
año,
last
pero bueno,
webinar
como siempre vamos a
of
estar compartiendo
RedETSA in
otras
the year.
iniciativas de capacitación e
But then we're going
intercambio que
to
están
be
relacionadas con la
sharing about
temática
other
en la lista de
initiatives
distribución
that
de
have to do with
RedETSA.
the topic in the
Para
list
quienes estén
of
inscritos
RedETSA's
también
distribution.
enviamos en el chat
And for those
la
of you
dirección
who
para
have
inscribirse.
not
Y con los
enrolled
miembros, con
in the
nuestros queridos
chat, you'll
miembros
have 17,
para la reunión
exactly
de
in a
fin de año
month,
de
for the
RedETSA.
end of
Les
year
deseo a
meeting
todos
for
un
RedETSA.
excelente
And I
jueves
want to
y un
wish you
muy buen
all a
descanso
wonderful
y fin de
weekend
semana.
and have a great day.
Muchas gracias.
Thanks a lot.
Gracias, muchas gracias, Marlene.
Thank you,
Chao,
Malin.
chao.
Gracias.